Professor Bruce Campbell is one of the UK's best-known vein experts. He's currently president of the Venous Forum of the Royal Society of Medicine. I wanted to ask you for your opinion about the role of guidelines currently in the United Kingdom. It seems to me every time I pick up the latest Phlebology magazine, there's a guideline of some sort, either telling me what I should be doing, what concentration of something I should be doing, the order in which I ought to be offering treatments. And there's been advice about consent and so forth. So I just wanted to explore that with you, and particularly in relation to NICE guidance. And what would happen to a practicing phlebologist now if he were not to follow the guidelines? Do you think there's exposure? I used to say, almost as a badge of honor when I ran my clinic, we follow NICE guidance. We'll offer you treatment in line with CG168. We're going to offer you endothermal ablation. If that's not possible, we'll offer you ultrasound-guided foam sclerotherapy. And thirdly, if none of those are possible, we'll offer you surgery. But of course, it's always possible to do ultrasound-guided foam sclerotherapy. Phlebectomy, I used to be a phlebectomy enthusiast. I'm now a reformed phlebectoholic. But that aside, tell me, what is the place in your view about guidelines? Let's imagine a situation, a hypothetical situation, in which I inform my patient that ultrasound-guided foam sclerotherapy, in my opinion, is the right answer for that person. The person has a complication and they see a medico-legal expert who says, well, you should have been offered an endothermal ablation because we don't know where foam goes. It could have gone into the femoral vein. It might have gone into a perforator. We've heard of Professor Campbell's concerns about the foam entering the popliteal vein from the small saphenous. We've heard his concerns about bubbles going into the deep vein. Where do I stand? What's going to happen to me? Am I going to be found negligent because I didn't follow NICE guidance? Are you going to be found negligent if you don't follow your own NICE guidance, which you helped wrote?
Just the first thing to say to you, I wasn't allowed near any guidance of any kind to do with veins.
NICE?
NICE guidance. No,
NICE?
NICE guidance. When I was on the NICE appraisals committee, and then I chaired interventional procedures. But because of a perceived conflict of interest, I was not allowed even to be in the room when there was any guidance being discussed that pertained to procedures that I did in private. Simple as that. So I had nothing to do with any of them.
NICE guidance, CG168. Nothing to do with it.
Other than the fact I precipitated it happening, I was not allowed anywhere near it. No. That's very, very important. The only people who are allowed near it who had a vested interest were the experts who were invited onto the committee. So I had absolutely nothing to do with it, except for the fact that I actually precipitated it happening. That's another story. So no, I have nothing to do with that. I think that NICE guidance has clearly become very potent. And it is used without doubt in medico-legal circles that if you've actually not followed something that stipulates that do this, don't do that, without putting in writing, look, I'm doing this for these reasons, which is fine. I mean, it's perfectly all right to do that. But provided you have justified somewhere in documentation the fact that you're not following guidance. This whole business was offer this if so-and-so isn't suitable, which is the words, in fact, for the various varicose vein treatments. That does leave a whole lot of sort of flexibility. It's not saying you must do this, you mustn't do that. So I don't think you can impart that meaning to that particular guidance. I think the important things are, I have very clear written information about each of the treatments I use, cyanoacrylate glue, foam, surgery, all of them. I have clear written information, including all the risks and everything, which I actually review annually. And when any patient's considering any of them, I give them the printed information. My letter, and I write very explicit letters to patients copied to their GPs, saying we've discussed this, we've talked about that, here are the options, I've given them written information. So actually, it just isn't in my practice, and this is what I would expect anyone to do, it is just not feasible for someone to come back and say, but he didn't discuss this. I did, because it's written down there, we talked about it, I offered you these choices, I gave you the printed information, here it is, it's got all those risks in it. And I just think that's a normal part of the consent process. And so long as you've done that, I think you're medico-legally very well protected. And I think also that as you say, there are lots and lots of guidances out there, but I think so long as you have justified any sort of decision you're making that someone might argue with, I would always put down 1 or 2 reasons why I'm doing it. Put it to her that she could have this, but so and so, and actually following discussion, we have agreed on that. Now, to me, that's just common sense. And it's not doing that. And in particular, one thing I find particularly irritating is when in medico-legal cases I see this sort of page of print that's clearly just been copied and pasted to every patient. I have to say I do try and do things on a personal level, so it's clear there's been individual consideration about that patient. So those are some of my thoughts.
Thank you. Do you make a distinction between guidance and guidelines? Is there a distinction?
It's a really difficult one. No, guidelines. Yes, if it's a nice guideline, I'll call it that, and other things I'll call guidance. It's a very difficult one, and I think different people have different understandings of it.
So we shouldn't be fearful of ignoring guidance, or not ignoring it, but reading it and taking it into account.
Not in the slightest. And NICE is clear about this. And this is a point I've made in discussions when I used to be, the NICE board and so forth, and we discussed these issues in terms of, it's very, very clear that, yes, it's perfectly okay to depart from NICE guidelines, provided you make a clear record, we're doing it this way because.
And could those reasons be financial? Could you say? You're offering the Rolls-Royce treatment as you've described it. It's very expensive. Is it covered by insurance? I can't remember now.
The insurers all vary. Some of the insurers have stopped paying for varicose veins at all. Like the Benetton Healthcare have recently stopped paying for varicose veins. No, but the point is, occasionally, I will put in letters to patients. We've discussed the costs, we've offered this, that, and the other, and actually, she has opted for foam sclerotherapy because. And I also often put things in letters about offering patients the best value. That they've chosen it in part because of cost. And which I think is utterly fair, so long as it's explicit.
Well, thank you very much, Bruce. You've been very open, very clear, very articulate as usual, and very well referenced, and you made your cases. I'm sorry I couldn't persuade you to reconsider glue and consider perhaps endothermal, or even even better,
the ultrasound. If somebody put a radio frequency machine in my operating theatre that I could use as an alternative, I'd be prepared to offer it. But again, I come back to the business of, when you've got not a huge practice, I do think it's important to remain really good at one thing. And that's why I've made the decision I have.
Thank you very much, Bruce. I hope you found that interesting. I must say, I'm still very surprised that Bruce continues to use cyanoacrylate glue in his practice. I haven't been able to persuade him about my concerns about the immunological and foreign body implications of having glue in the leg. I haven't been able to persuade him that ultrasound-guided foam sclerotherapy is at least as good as other treatments for veins. And I haven't been able to persuade him that ultrasound-guided foam sclerotherapy is the only way to deal with the venous leg ulcer crisis in the UK. I'd be interested to hear your views. Leave them in the comments section below. Do you use cyanoacrylate glue? Have you used it in the past? Do you continue to use it? Have you stopped? I want to know what you do. Please consider subscribing to my channel. It helps with the algorithm and it encourages me to make more videos. And don't forget to subscribe, and that way you won't miss my next video. Thank you once again for watching.